Welcome to Image Monitoring USA's explanation of how to use the Falcon Xpress System. And is what we're looking at right now is the two main cuffs that you get with the system. You do get a size 10 and a size 12 cuff. As you can see, they are different widths. And you always want to use the proper width configuration. You'll also get a digit cuffs, two 1.9 and two 2.5 digit cuffs as well. Is what we're going to talk about right now is wrapping the arm properly and the proper cuff selection. When we look at our cuff is what we want to do when we're looking at the arm. We want to look and see if the cuff is bigger than the arm or about the same size as the arm. And you can see this one's quite a bit bigger than the arm. So I'm going to go with the 10 instead of the 12 so that we can go ahead and wrap the cuff properly. If you wrap the wrong cuff on, you could get the improper cuff to girth ratio on it, and it could cause either a higher or lower pressure. So what we're going to do now is wrap the cuff on the patient. When we wrap the cuff, we can go either on the upper arm or on the forearm if needed. So if a patient's had a mastectomy or anything of that nature where they don't want you to do a brachial pressure, we can always do a radial or ulnar pressure on the forearm to be able to get that pressure. To wrap the cuff, you want to wrap and go up as high as you can into the arm if you're going up on the high brachial, which is typically where we're going to be. We want to give a lot of space here for us to be able to go in and get this brachial or to come down here and do the radial and ulnar. So we wrap the cuff like so on the patient, nice and smooth, good wrap. Typically you'll wrap both arm cuffs at the same time on the patient. A good practice to get in, if you can get on both sides of the patient, it's always the best, because there's a tendency if you have to reach across the patient that you're going to wrap that cuff a little bit looser. And of course that will affect your PVRs, can affect them significantly, and also it can affect your pressure if you have one cuff nice and snug, the other one loose. Same thing that we did on the arms with looking at the proper cuff wrap and selecting proper cuff. Remember, we always want to make sure we're the proper cuff to girth ratio. Easiest way to do that is to look at your cuff. As long as it goes from side to side, then where you're covering up the entire leg with it, that looks great. I know I've got my right width for her ankle. But if I went to this cuff, you can see it's quite a bit larger. And when I go to the 12, if I put that cuff on, then I wouldn't get the proper cuff to girth ratio with the arm because the arm is approximately the same size as the ankle, so I want to go with the 10. But in some cases, there are patients that have bigger arms or bigger ankles that we would need to have 10 and 12 or 12 and 10 on the arms and ankles. So now I'll wrap the cuffs. So what we want to do is make sure that we're conscientious of where the hose is. We don't want the hose to be on the top of the patient because we can cause a little bit of a pinch point, which isn't very comfortable. So what we're going to do is wrap the cuff, and because I may do a post exercises on this patient because they may be a claudicant patient, is what we're going to do is wrap the cuffs on. We want to be at least 2 finger widths above the medial malleolus, above the ankle, and we're going to put this on nice and snug. Not tight, but snug and smooth, so that way we have a good nice smooth wrap, and we're going to get a nice accurate pressure on the patient. Really like these new cuffs because they can clean really easy and they're nice and smooth. The patients like the feeling of them because they are so comfortable. Now that we have our cuff on, we're going to hook our hose, and if you look at your screen, it's going to tell you what hose goes where, and you'll see that the arms were red and red-white for the left, and now we've got the yellow for the right, yellow for the left, and we also have our V-fit connectors, which are really nice because now it's just a put in and twist, and you can do that with one hand really easy. What you'll notice sometimes when you go to do a PVR, and that's what our next step is, you'll notice that sometimes you'll get a little oscillation caused by the patient's heartbeat. Sometimes when they have a lot of edema, you'll get oscillation back and forth from that pooling of blood. So what I like to do is take a towel or anything of that nature and put it right underneath the patient's ankle. And what you'll do is notice that now I can get my finger underneath the cuff. It doesn't have to be a lot of room, but just a little bit of room. That gives that cuff enough room to oscillate to give us a pure PVR waveform without getting artifact from the bed, from the heartbeat. So I'm just going to hit inflate now. The system's going to inflate to 65 millimeters of mercury. When we go inflate to 65 millimeters mercury, that shuts off the veins, gives us pure arterial flow. Now you can see I've got my beautiful waveform on there. Now I can freeze that. I don't have to be worried about my scale because you remember, you have post-editing, so I can increase my scale afterwards. I can also move my baseline just by moving that waveform down. I can scroll back and forth to other waveforms if I want, and I can bring that scale down one more, down a little bit lower. And there I have my nice PVR. You can see I've got my RAR turned on, relative amplitude reduction, turned on, and that helps for inflow disease. So if I was doing that high thigh PVR, it would help us decide if we were interested in doing possible ultrasound or something of that nature.